Move us to the public comment section. Are there any public comments?
I have a few comments to make.
Can you recognize yourself?
This is Amy Jeffers.
Okay.
Right.
I have been very concerned about the virtual learning platform as an educator myself, and then also as a nurse, just with giving the option for our students to be able to attend school, just as we're given the option for those to be virtual. And would like the board to consider and urge them to really look into other school systems and data that has been proven all around, that shows that it is safe to attend school for children, and just see what kind of data RCS is keeping up with. What are our numbers for students that are not participating virtually? What are our numbers for those students that are failing due to being virtual? What are you all doing as a board, as administration, for all those children that are being left home alone while working parents are working? What about those parents that have had to quit their jobs? My list continues on and on and on. So I just want to know what is different with RCS than any other school system, and can that be addressed?
JP, I'll let you.
Oh, yeah. So during public comment, the board typically does not respond during public comment because it's about items that aren't advertised on the agenda, and so we technically have to follow the agenda. But if I would be more than happy to sit down with you and visit with you about these things, if you'd like to, me and my leadership team, we're more than happy to sit down at any point in time. We can do a virtual meeting and visit with you about your concerns.
Okay, that would be perfect. I would love to sit with you virtually. I know that lots of other parents have already done that, and it didn't really seem like their voice was really heard. I know that there's also a petition about parents that would really like for their children to be in school. And I, as an educator, fully understand the difficulties right now teaching during a pandemic. But I'm considered an essential worker, so I report to school every day, and I get to love on my children every day, which I'm very thankful for Hawkins County School System, for that board, for that director. We're getting to go to school and participate in person and doing very well. There's only 2 positive cases that have been linked to actually going to school that we've had. So I would like to know what your all's data is with what the COVID cases are at RCS. I realize now as a nurse that this is probably the worst time for COVID. So unfortunately, to be speaking about COVID situations right now, this is the peak of our pandemic that we've seen so far. And I do realize that other school systems have closed for this week. However, I also realize that my son is a 7th grader, and he might have gone to school 6 to 12 times, give or take, since April. And I'm a very concerned parent about that in my child's education. And not just my child's education, but also his social ability to be able to go to school and interact with peers, have that group interaction, have that personal feedback from teachers. There is a lot that he is missing out on, and every other student too. And I just wonder what we're doing with our special needs children, those children that need that hands-on learning, that need that one-on-one undivided attention. What are we doing with those students? Are they just falling through the cracks? I know that I'm speaking for a lot of concerned parents, and I think the issue needs to be addressed, and needs to be addressed sooner than later. And I think that you're going to have a lot of virtual meetings with a lot of parents, unfortunately.
Board, my name is Mandy Kenner. I have a student who is in the 8th grade. His name is Nolan, and he has Down syndrome. And I have sent each of you, each board member, an email this afternoon, in addition to Mr. Stroder. And I'm going to read, just for those whom I did not send this to, a snippet of that email. I fully understand and support the need to close a school site to in-person learning when there are not enough adults to monitor students due to adult isolation and quarantine. However, remaining virtual because there is a desire not to change schedules is, in my opinion, unacceptable and an injustice to our students. It appears that the COVID-19 data currently being used by RCS is community EpiCurve data that's published by the Tennessee Department of Health. And while that is very, very important information, I feel it should be used in conjunction with other data points, such as district level data, as recommended by the TDOE soon after the fall semester began. Using multiple data points and drilling down to appropriate demographic would seem to be more applicable than solely focusing on community data that includes positivity from testing at jails, long-term care facilities, and other demographic groups that do not directly affect students and staff in a school setting. Additionally, using expected data, such as a holiday is expected to create a spike in cases, as was presented on the Facebook post, is an assumption, just as the likelihood of being in an automobile accident is certainly a possibility, but most people still choose to drive safely each day. Board and administration, please take parent and guardian input and their feelings into consideration. Please use relevant multiple data points. Please consider all student populations, especially our emerging learners, pre-K through 2, and our special education students who are struggling every day. And please take a hard look at students' social, emotional well-being and consider the huge burden this has placed on teachers. And please, please always do what is best for our children rather than placate those adults, whether they be parents or school staff who may be fearful during this time. Thank you.
Hi, my name is Ashley Lyons, and I wanted to make reference to what you posted on Facebook in regards to in January, due to there being a vaccine available, that we would be able to return to a somewhat normal functioning system. I would like to know what your plan is in regards to administering the vaccine to your staff.
We'll be following the Department of Health guidelines. We meet with them on a weekly basis.
So this will remain optional?
Yeah.
And it will be based on availability, which is going to be less than originally assumed our amount would be, correct?
Yeah, we know there's 40,000 doses coming to Hawkins County in the first round, so we think we're probably going to be okay.
So will this change your availability to meet in class?
It all depends on when it's going to be available.
It is starting to be available in December.
I do have another reference too. I know that the Times News has been keeping up with all different systems here and there. And then I noticed that one of our comments made by RCS was that we were saying, how is COVID affecting RCS? And the comment quote said, a few here and there, but nothing significant. So if nothing is significant with RCS, I'm concerned about why we are not attending like every other functioning county surrounding us.
So we do know the vaccine's coming. Our hope is after the Christmas holidays, we think we're going to be able to at least move back to the hybrid schedule that we were under. Ideally, we would like to do more than that, but we're just not in a position to know yet. We're planning on meeting over the Christmas break, staff or admin team, just to kind of keep track of the numbers and monitor where we're at in terms of getting the vaccine. So, I guess just stay tuned, and we'll update the community as much as we can on where we're at and where we're headed.